Hey y'all, welcome back to the channel. This video is going to be an introduction to perimenopause and menopause, terminology, symptoms and signs, things like that. I plan to do a multiple step series here. Right now I'm thinking about 6 videos to make a playlist, with this being number 1, and this will allow us to just start the talking points on an even playing field where everyone has the same foundations. I'll give you some more tips about where you can find a menopause care provider near you if there's one available, and if not, some telehealth options potentially as well, and some red flags or other things you should definitely talk to your doctor about first. So without further ado, let's start from earliest in the timeline to later. Perimenopause. This is a transition, usually of several years, anywhere from 6, 7, 8 years before menopause takes place, where your hormones are going to go all silly-willy and you will experience a multitude potentially of symptoms. These can range from anything from mental fatigue, brain fog, memory issues, to energy fatigue, libido, vaginal dryness or irritation, urinary changes, hot flashes or night sweats, you name it. There's a huge list of symptoms that can be associated with perimenopause, and what I usually tell my patients is not everyone's perimenopause journey is the same. So you may have a friend or a family member who has one journey and yours can look drastically different than the other. If that doesn't make it confusing enough, there's also times where we may want to investigate other causes, such as maybe thyroid condition, poorly controlled diabetes or insulin resistance, things like that. So there may be a time and a place when your doctor will want to do some kind of investigation or lab work, and I think that just depends on the story, family history, if you are aware of any family history for your mom, your maternal grandmother, sisters, if you have any older siblings, things like that. There's some factors socially that your doctor may want to know, if you've had any kind of surgery or endometrial ablation, if you have a Mirena IUD and that's impacting period changes as well. That could be something that can make it a little trickier to know truly when you'll go into menopause, which we'll get into in a minute. If you've got a smoking history, that can be associated with earlier menopause as well, things like that. So make sure you have a good primary care doctor or someone who's keeping up with your medical history to put all of these dots together and really make sure we're capturing as much as we can about you in the first place. So, like I said, perimenopause is a transitional period, usually spanning over multiple years. Some lucky ducks will have lesser, some may have more like 10 years of symptoms before we get to menopause, which is one fleeting time where you are considered to have no period for a year. And as you might assume, based on that phrasing, it can be a little tricky. If someone's had an endometrial ablation where the lining of the uterus has been removed, they have a Mirena IUD, so they don't really have periods or very, very light ones. If they've had a hysterectomy or other things like this, it can really muddy the water for how calendar date wise how long it has been since a last period. So sometimes I'll reference things in my notes like surgical menopause after a hysterectomy for XYZ reason. I always like to know why someone had a hysterectomy and what kind, whether it was a partial or total hysterectomy, did they leave an ovary or both ovaries, things like that is a good history you may want to let your doctor know about so that they can get a better understanding of your history and key information from that moving forward. So for people who have like really heavy periods, that can be something associated with perimenopause change. If there's a lot of that in the family, then it might be something important to know because that may occur for you as well. And no one really wants to have a lot of heavy periods all the time. So that can be really distressing and something that we want to target when we're talking about all of your options for menopause, hormone replacement, or not, if you decide to not do hormones. So we've covered perimenopause as the time. There are some factors that can influence how early or other symptoms that may go along with it. We've determined that menopause is just one point in time where you've been without a period for a year, if you are still having periods, if you are someone who's had maybe a hysterectomy or something where we don't actually know if you're in true menopause or not. Some doctors may consider doing something like an FSH level, follicle stimulating hormone. If it's higher, 25 or more, something like that, we might can assume that you are in that post-menopause time period and go from there. But all in all, this transitional period of perimenopause to menopause is largely a clinical diagnosis. You don't have to have any lab or number that we're shooting for necessarily for hormone levels to get a diagnosis. In fact, they may change day to day, and they definitely will change hour to hour. So there's usually not a lot of people that are said like you have to have this exact number on our labs to get a diagnosis. Anyway, I digress. Post-menopause, that's going to be the time after menopause. That's that time where you've been without a period for a year, moving forward for the rest of your life. So from then on, you will be considered post-menopausal, and that's when we'll want to watch you and check other risk factors for, heart disease, body composition, bone density, things like that, and other kind of cancer screenings as we would normally counsel you about. So there's a good timeline. Like I said, the average age of menopause in the United States is about 51 and a half years old. If you are someone who's experiencing perimenopause symptoms, you think, before the age of 40, or maybe you're having really, really, really heavy periods that are just constant all the time, or you're still having a period that's very heavy after the age of 55. These are all some examples of when you'll definitely want to talk to your doctor and see if there's more going on. Other examples could be really abrupt changes. A lot of this can kind of be built up over time. But if there's some abrupt changes or mood changes or things like that, that could be another reason you'll want to bring it up to your doctor. But I hope these terminologies or definitions of things brought some light to what you may be experiencing. If you have a story that varies from anyone else's, that's not too surprising. I think Oprah was someone who her key symptom, or what she's talked about, was heart palpitations, which is not something that a lot of people talk about regarding menopause symptoms or perimenopause symptoms. So more people are more accustomed to thinking about hot flashes, or maybe some genitourinary changes like vaginal dryness and fatigue. So anywho, now we have the terms. In my following videos, we're going to talk about other medical options. Obviously, lifestyle is a huge foundation for any of this, whether you're doing any prescriptions, hormones or non-hormones, anything. You really need to try your best to be eating well, an anti-inflammatory diet, getting enough protein and fiber, making sure you're exercising, especially at this point in life. Resistance and strength training for bone health is just wonderful, and it will help other metabolic things as well. Try to prioritize sleep as much as possible in what you can do, whether it's sleeping with a cool fan or air temperature around you in a dark, quiet environment. All these things are going to be a great foundation. And then if you still continue to have issues, that's where we as your doctor can come in and meet you where you are and get you a treatment plan moving forward based on your risk factors, what you're comfortable with, and what's affordable and accessible, things like that. So stay tuned. Next week we're going to talk about starting in the hormone section, systemic estrogen options, which are probably the most common and more logistically tricky at the moment. At this time I'm recording in the summer of 2026, so we're seeing some shortages in a variety of areas, and I can talk to you about how I'm navigating that a little on my end, so on and so forth. So stick around, subscribe, and I hope I see you next week.